When parents put their children in daycare, they do so trusting that their kids will be cared for and kept safe. And that's because we have systems in place to regulate and monitor health and safety practices in licensed facilities. We know this outbreak has shaken that trust, and as policymakers, we must do whatever we can to ensure this doesn't happen again. During the crisis, our top priorities were looking after the people who got sick and tracking and containing the source of the outbreak. But we also recognized that we needed a clearer understanding of how it happened. That's why, as the crisis was unfolding last September, I called for the creation of a review panel to get to the bottom of what caused the outbreak and to ensure the policies are in place to hold operators accountable and to prevent it from happening again.
After receiving the panel's report and recommendations, our government moved quickly to develop an implementation plan. We will immediately start implementing measures to improve the safety of children in licensed facility-based childcare. This includes several measures with a focus on promoting a culture of food safety in licensed childcare. Food safety culture will be addressed through the introduction of mandatory staff training, increased transparency of food safety compliance through prominent posting of public health inspection reports, and creating awareness among parents and staff on how they can report safety concerns, including anonymously. We will work with our colleagues in Alberta Health to develop a process to require staff and volunteers to sign statements on food safety culture as part of their ongoing training. In addition, we will ensure our childcare operators have the tools they need to action these recommendations, and will collaborate with our partners to develop the resources required to assist them in adhering to policies and best practices.
As far as for those folks that have their children in daycares, that's why we came up with the recommendation, and it came up and we heard it from the families that were impacted. They said, why weren't every previous inspection posted in a conspicuous spot so when they walked in to drop off their children, right there on the door, right there in plain view, results of latest health inspection. And like so many of them said to us, you give us the information, we'll make our own decisions about how we follow up on that. So that's the two-pronged approach that we heard, and the one about giving parents the information that allows them to make good, solid decisions was key to that recommendation and the series of recommendations around that.